Now, I wanted to share why I wanted to have this conversation about hormones and the perimenopausal and the menopausal process is because, one thing I can relate to all my clients to, whether any age, is our hormones. On a monthly basis, I have challenges with my own. I know some of you all have expressed different experiences with your own, so I thought this would be a wise conversation for all of us because, of course, there's some younger generation here and some elders here, and I think it's very important for us to learn from one another through all ages because we're going to experience it one day, right? So, questions will definitely be held at the end. So please feel free to leave them. I'll pass you the mic once we get there. But I want to begin with the panel introductions. I'd just like you to introduce yourself, and then we'll go from there.
Hi, I'm Christy Vitiello. I have an acupuncture practice for over 18 years. My anniversary was like 2 days ago. 18 years on Jackson and Van Ness, and I specialize in women's health. I also am a metabolic balance coach, which specializes in a food-based program helping nutrition and doing that without supplements. And and I love doing acupuncture, and that's how I know Simone. So we'll pass this on.
Yeah. I'm Dr. Amy Day, and I'm the founder of the Women's Vitality Center, which is a virtual practice now. So I'm based in the East Bay, but we can work with women, women plus, we say, gender identities welcome if you have ovaries and are dealing with hormonal issues. So we work with women plus throughout the state of California. And we are women's health and hormone specialists, and particularly perimenopause, but certainly the before and the after as well. But there's such a need for support and understanding and education and guidance during the topsy-turvy part of perimenopause. So that's really my passion and my expertise, and I'm delighted to be here. So thank you.
And I'm Dr. Brittany Crawford. I'm a clinical psychologist. I currently work at Kaiser Behavioral Health and specialize in perinatal mental health. So more so pregnant women or women who just gave birth. And I also specialize in pediatric mental health. So go with it. And that's it.
I'm Dr. Claire Graser, and I actually work with Dr. Amy part of the time, and then I also see patients and do nutrient IVs and injections with B12 Love in the Marina. I also specialize in women's health and hormones, and have special interest in perimenopause, menopause, chronic UTIs, thyroid disorders, PCOS, and all things of that nature.
Thank you, ladies. Round of applause. Round of applause. Okay, so we're going to get right into it. I'm going to start with Dr. Day. Dr. Aspects of our health, definitely. And I want to explore the magnitude of their effects. Can you explain what hormonal balance truly means and what it looks like when it's out of balance?
Okay, I have 3 minutes. So I'm going to say a little bit about hormones, a little bit about balance, and then a little bit about hormone balance. So hormones are these tiny little chemicals that float around in our bloodstream, and they are almost insignificant. They're like so tiny, but they have a huge impact. I think of it like a hinge that swings a large door, or if you're familiar from chaos theory, the idea of the butterfly effect, like one butterfly flap of a wing can cause a tornado somewhere on the other side of the planet. So they're small, but they're mighty. And they're carried around in the bloodstream attached to proteins, that binding proteins that carry them around. And when they become free or released, they interact with the cells in the area and have their effect, whichever hormone it is. That it's an action of balance and balancing. Think of if you're ever seen someone balancing a broomstick on their palm, and it starts to lean this way, you've got to come up underneath it and give it a little more support in that direction to help get it back to stability again. And that's if it was only one hormone, right? Then we have all our hormones and kind of finding that balance. So what can happen if our hormones are out of balance are things that probably everybody has had, your own version of experience of different hormonal imbalances. That can be cycle changes, it could be mood changes, it can be energy, fatigue, sleep problems, skin and hair changes, libido, vaginal dryness, hot flashes and night sweats, bleeding problems, all sorts of different things that can come from having our hormones out of balance in different ways and the different hormones. So a big part of figuring out hormone balance is figuring out which hormones are we talking about and what direction are they out of balance, so we can get up underneath there and give it more support where it needs, because they have such a huge effect on how we feel and who we are as we go about our daily lives.
Definitely. Thank you, Dr. Day. Dr. Crawford, could you elaborate on how the psychological impact of hormonal changes, both beneficial and disruptive, can manifest in the present and potentially shape long-term mental and emotional well-being?
Yes. It's a big question. I will start by saying that, I know the topic for today is for menopause, premenopause, but Claire's also mentioned there are other hormonal related conditions that can impact mental health long term as well, in addition to PCOS, thyroid issues, and any other type of endometriosis, other things like that. So just keeping that in mind, I think, is helpful, because maybe not everyone is at this moment menopause, maybe there are other things going on. But when it comes to what are the benefits of hormonal change, I think I'll start with that, because we don't really talk too much about the benefits of hormonal change. We also we talk about the negative impact, night sweats and irritability. But I think one of the main benefits for me.
Thank you.
Thank you. One of the major benefits, I think, in a mental health point of view, is that identity shift. When it comes to hormonal changes, for the most part, what we see in, media and what we've heard historically is women are going through menopause and they no longer want to have sex, and now they're mean and they're moody. And who are they now? Who are you? What are you good for? You're not bearing children. That kind of shift, of that identity shift of okay, why? But I see it more of a positive identity shift, because I think that we're some of the only creatures that live past childbearing years. And I don't know the research, so I'm not going to lie to you and tell you I know. But someone somewhere looked into that, and they seen that, it's because older women who have more experience, there is a necessary function for them in society. We look to women as our elders, we look to them for knowledge, we look to them for wisdom. So there is a function for us surviving past childbearing years. I'm sure maybe even for some other animals, but
Orcas,
yeah, because older.
There's very few mammals though.
Yes.
It's called the grandmother effect.
That's what it is, the
Matriarch.
grandmother effect. So there is a reason for it. I think that having that information in the therapy room is helpful, because most of what women are thinking about, we're thinking about ourselves, who we are, how we show up in society. And I think that's one of the positives, is knowing that there is a greater purpose for us surviving past those years. It's also just, one of the benefits is also knowing what change looks like in us, because I think that going back to the grandmother effect, we have a duty almost to further educate the youth, right? Because we're going to have daughters, granddaughters, nieces, and things like that, and they're going to have questions about their menstrual cycle, which is, their own version of hormonal change. So I think there are benefits in knowing that in terms of mental health. And then there are other benefits, but then we'll go to the not so great parts that I'm sure you all are familiar with, but probably do want to hear about that, negatively, at least I think serotonin more impacts estrogen impacts our serotonin and our progesterone and oxytocin and things like that. So some of the negative impacts of having that shift would be increased mental health, increased anxiety and depression. And if you already have anxiety and depression, then that kind of worsening in a way. Estrogen is, not estrogen, progesterone kind of impacts
our mood and stress regulation. So when that is changed and influx, that's where you probably see it more so in your sleep. You're sleeping negatively impacted, and that irritability, like if you're feeling like I'm snapping, like I'm skating on thin ice and things like that, and that's that progesterone piece there. And the long-term negative impacts is that, that can negatively impact our relationships, or if other people are seeing us as a bit more moody, we're not having as great a sleep, and just overall physical health, because sometimes when we're out of balance, we get off of our routine, and we're not on our routine for a bit. That's one of the longer and negative mental health impacts. But I think we should focus on positive, which is that impact and identity change.
Definitely.
Yes.
Well,
I'm 34, but the mood changes and the fatigue and just the overall process of having to go through that monthly cycle is very, if you are familiar with it, it's a lot. It is a lot. So, you don't even have to be in these perimenopausal stages or ages to experience this. We all do experience this potentially on some level, some more than others. Thank you. Okay, so Christy, my question to you, being a acupuncturist and a herbal medicine practitioner, what is the traditional Chinese medicine philosophy when it comes to hormones, and which organs do you prioritize healing and why?
So I feel like there's a lot you can do with Chinese medicine every day with the hormones, and the organs let me start with this. I think that we go into the sphere, I'm pretty loud, right? I just, we go into the sphere that menopause and perimenopause is going to be so awful. And what I find is that what happens is your story doesn't have to be the woman in the grocery line taking the People magazine, vigorously, fanning herself and having a full sweat bath right there. That is not necessary. This is not your journey. You can say that's not going to be my story, because the more you regulate your hormones now, in whatever age you are, is the better path you're going to have for perimenopause and menopause. And the things you can do for your hormones, like if we just go through the cycle, when you have your period, that is the time to restore, relax. This is not the time to do 8 miles and run and when you're having your period. This is the time to gather and rest and give your body a break. Then the next phase before your ovulation, this is when we're kind of, if you guys know Esther Hicks, getting ready to be ready. That's her thing. And so you get ready to be ready. We're kind of prepping up for ovulation. We're supporting our system. We're eating meats. We're eating really blood nourishing foods, leafy greens, supported protein. And that is getting ready into ovulation. And when you get into ovulation, this is the time where this is your highest power, right? Your greatest fertility. This is when you make the decisions. This is when you do all the things. And this is your PowerPoint. And then you're about to go back to cycle, but you still have, day 21 through 28. And when you're about to do that, what we want to be doing is we want to be exercising. We want to be lowering our alcohol intake. We want to be lowering sugar intake, because the more we move and get our bodies supported, the better period we're going to come. It is too common that people are like, yep, I have PMS, I have cramps, I have breast tenderness. This is common, but not normal. And this is a misconception people have. If you can control your cycles with herbs, food, acupuncture, any of that, this is what's going to get you through, and your cycles will calm down, being more normal, regulate to the ideal of 26 to 32 days. Everyone's going to be a little different. If you're not exactly on 28, it's okay. And the 2 organs that I always talk about is the liver. The liver is in Chinese medicine, we have liver qi stagnation or liver congestion. And if you can smooth the liver and you do more, exercise and movement, I don't even care if it's just walking, that is great, and you calm down the liver. And the liver is what kind of is the controller of if you're having the breast tenderness and the cramps.
The more you stress, you know how we're all like, I'm fine. And then like this inside, but you have to be good for your friends, your family, your partners. That is liver qi stagnation. So the less you can do that, which is being mindful and meditating and moving, then the less your period is going to be much better. You're going to notice the months you guys have stress, those are the months that are going to be an issue with your period. You're going to have more cramps, more breast tenderness, a little more clots, all that stuff. I'm doing two questions in one, right?
That was one organ.
Okay.
What was the second organ?
The second organ is the spleen, and the spleen is the nourishment. Spleen in Chinese medicine is so big. Western med's like, we don't need a spleen. Chinese medicine, we need a spleen, okay? And the thing is we need, the spleen controls digestion and also controls the blood, the transformation of all your fluids, your yin and your yang. And nourishing the spleen is very key, and great things to do just for you guys self for every day is not eat raw food, eat more cooked food, nourish. Something called congee, which is rice porridge, is so great for our spleen. The worry, when we all worry all the time, this is affecting our spleen. So if we mindful eat, and we meditate, and we get some sleep, and you guys, please, sleep can cure half the things. So get some sleep, don't go 5 hours, go 8, These are all things that nourish the spleen. Eat your fats, that makes your hormones. It's really good to have a good conscious diet and, support your spleen.
Wonderful. Thank you. Yes. And of course, we know how important nutrition. I love that you said that because, like I said, I teach the movement meal mindfulness theory, so the M3 formula. And I feel like a lot of times, sometimes we feel like just because we're moving, and although we may not be eating the best, or we may not be practicing that mindfulness, and it's all good because we're doing 1 of 3 or 2 of 3. But we really need the trifecta. You really need the whole spectrum to propel, which is something that I've learned. And I must say, yes, with Dr. Christy, is that the herbal medicine that I've been taking for my challenges has tremendously helped. So I can speak to the herbal meds and the different practices on that end because I've experienced them. So wonderful. Thank you. Excellent. All right. So Dr. Claire, I've also worked with Dr. Claire at B12. She has given me a lot of micronutrients, a lot of iron is what I've been focusing on for the last few to help with my needing more sun in San Francisco ways, and more energy and more iron. So Dr. Claire, I have a similar question for you. When a client seeks hormonal health advice, which minerals and micronutrients are your go-to choices at B12 or in general, and why? And then what are the best avenues to continue getting these necessities?
Okay, is that working? No.
Okay.
Well, there are so many different nutrients for different reasons, and so I think figuring out what someone's health concerns are, or just what their goals for health optimizing is really important. I have many nutrients, but maybe just a key few of those. I do think iron is definitely one of the most important for women, both pre-menopausally and sometimes even after menopause, even though you're not menstruating anymore. If you get into a deficit premenstrually or in the perimenopausal transition and you never know it or you never do anything about it, then you can still have fatigue and hair loss and slow wound healing and memory issues. So we usually do test ferritin levels, which is the storage form of iron. You can be iron deficient and not be anemic, which is a huge percentage of the population. So a lot of times it gets missed because they don't always test for ferritin in just the standard annual lab panel. So I love that one. And we do IVs injections, or we have oral supplements that are plant-based, so hopefully a little bit easier on the stomach. The other couple of minerals that I really like, or nutrients, we were just talking about sleep and mood. I really like magnesium. It's one of the most amazing minerals that we have. It's a pretty common nutrient deficiency as well. You definitely can get it dietarily through whole grains and beans and nuts, chocolate. but it definitely helps with sleep. It helps with, along with B6, with estrogen detoxification and metabolism. That combination of magnesium and B6 is really helpful for producing serotonin in the body. So without doing an SSRI, you can support your levels naturally that way. And then just a couple of other things. I think vitamin D is super important. It's actually, it actually is a hormone. And we know it prevents diabetes, improves insulin sensitivity. It's really good for that seasonal mood issues, but really any mood issues. It can cause muscle pain or just muscle achiness when it's deficient. So anyway, that one's a great one. And then one of my other favorites, it's not really a micronutrient, but glutathione. It's a combination of amino acids, and it is the master antioxidant in the body. Really helps with liver detoxification, which we know is really beneficial for hormone balance, especially when people have endometriosis or fibroids or estrogen dominant conditions. And we do L.Ac is an oral precursor that you can use. A lot of people do with PCOS or other fertility concerns. But we do a fair amount of IV glutathione in our practice, and it can be really helpful for, feeling inflamed, PMSy, brain foggy. I've seen it really help with menstrual regularity, pain and cramping with menses, and you can kind of do it as a loading therapy when you're just like feeling toxic and not good. Doing it once a week for 4 to 6 weeks can get you a really good boost, and then all the other sleep and diet and mindfulness to kind of get you going. And as far as maintenance, I really think a whole foods diet is the best way to get your nutrients. But if you do have specific deficiencies, you can always recommend supplements or IVs or injections to get you back to where you need to be.
Wonderful.
I did see that both in the specific deficiencies. Like iron deficiency, B12, B6.
I would say those are more specific to women. The iron deficiency is more common in women because of menstruation. Vitamin D deficiency is common, magnesium deficiency is common, but I did focus a little bit more on,
Floridix is something that I used to take to get some iron or iron pills. What about those additional things?
Yeah, I think when you're taking supplements, that usually something in liquid or powder form is more absorbable than a tablet or a capsule, so that's always a good option.
Okay,
But I always just say whatever you're going to do is what you should do, because a lot of people don't want a liquid that they have to carry with them here and there or travel with or whatever. So a lot of times I'll say use liquids at home, and then if you're traveling or taking supplements at work, have a bottle of whatever it is in pill version if it's easier.
Thank you. Any other questions? Okay. Oh, yes.
I just have a general question for the panel on PMDD, and if you have any suggestions for how to treat that.
With acupuncture, we do different points and we treat it with acupuncture. So it is something that, most female issues, like we treat.
Yeah.
Different points do different things, and it depends on everything else that's going on with you. So, because we look at the body as a whole, just like naturopaths, just don't just look at just that. We look at how it manifests for the person that has it.
And just in case anybody's not familiar, PMDD is premenstrual dysphoric disorder, so it's a more severe form of PMS that has those intense symptoms leading up to the period, but then relief after the period has started. So that there's definitely a hormonal component to that, but all of the, your nutrition and your mindfulness and your movement, everything is going to help also. But we've definitely found that figuring out where the imbalance is, like working with estrogen or progesterone during that time of window, can be really helpful. Sometimes in conjunction with an antidepressant or something like that, depending on how severe it is, because it's important that, it can be really dark and really hard sometimes. But working with either or estrogen or progesterone can be really helpful sometimes.
Yeah, I would say the magnesium B6 combination is really good for PMDD. I've had amazing response with even just that. So,
And from the, I don't think this works. From the mental health point of view, I'd say at least for what I've done with people before is a lot of tracking. I think because there's a lot of dysregulation, being aware of what specific symptoms are happening and for the period of time. And this is helpful just to see if there are any patterns over like months, right? Because then you're more similar to with your period and like a period tracking app. You usually are, they like usually warn you like, oh, you know, you're about to be, what's that called when you're fertile?
Ovulating.
Ovulating. Oh. That's how you can kind of feel it in your body. You're like, I don't know why I'm a bit more sensitive today. I cried over a jelly bean falling, and just really tracking your mood day by day.
Yes, okay. I saw your hand first.
I wanted to hear your opinion about hormonal birth control methods and women. So, I mean, I always believe that having our own control of our pregnancy is very empowering for women, right? But many women, like me, for example, have very painful periods. I could never wear like a physical method because that would make my pain worse. So normally what they always recommend is the hormonal methods, right? Effects and everything. So I would like to hear your opinion about those.
I'll comment. I'll start it. So, like you said, and having that control is so important. But it's not the only method, right? And there are pros and cons. When we're being contraceptive, we are working against nature, so there's always going to be some kinds of pros and cons of how, different methods and ways to work. I have a history of endometriosis, really severe, so I was on birth control pill for many years to just regulate that. I needed through my 20s and that kind of stuff. But then when I wanted to live a more natural life in naturopathic school, I got off of it. But then it's been a whole journey since then of learning how to regulate my hormones and everything. So I don't like the use of the birth control pill as a treatment that suppresses symptoms without figuring out what's going on and giving women options of how you could potentially treat that. But it is one tool in the toolbox, and there's pros and cons. I think I kind of just agree with what you're saying, but there are definitely concerns for nutrient depletions and for mood problems and for weight gain and for libido effects and all of that. So if you're using it for contraception, are there other contraceptive methods that could work for you? If you're using it to treat a condition, are there other treatments that could help you treat that condition? But if you need it and, weighing all the pros and cons, maybe there's a period of time in your life, or there's ways to support your body by taking B vitamins while you're taking the oral combined pill so that you're more regulated. So those are some of my top thoughts.
I agree with what you're saying. But I think the problem is so many people have been on it for so long, you have no idea what you really feel like. And when I went off birth control, when I became an acupuncturist, I was like, holy shit, people feel like this? Sorry guys, I'm not supposed to say that. I was like, wow, I have so much more energy, my mood isn't insane. And then other people, with the pill feel more stabilized. But I think over a long-term time, people no longer know. Also, people don't know their period. So many women I have to explain what happens when ovulation, when you ovulate, what's number one day of their period. It's like we're not learning about ourselves. I mean, you can figure this out. We're supposed to have discharge before ovulation. That's the telltale sign. That's what's happening. When we look for that, you're ovulating. That can be your form of birth control. I just think we've gotten to the point where we've put people on this since what? You have acne at 15. Birth control, and you just stay on it because you're like, well, I had cramps at 15. Well, when you're 30, that's not necessarily the case anymore. And there are other things. Supplement